the first thing that you have to explain to folks when we're having a discussion about health care is that the status quo is unsustainable. Or another way of putting it, if you like what you have now, unless we make some changes, you're not going to have exactly what it is that you like. And the reason is because healthcare costs are going up so fast. As I said, 3 times faster than wages. Much faster than inflation in every other area of life. That it's going to gobble up a higher and higher percentage of your income in terms of premiums and out-of-pocket costs. More and more employers are going to say, we just can't afford to provide you health insurance, or if we do, we're going to push more and more costs onto you. You're going to lose more and more of your paycheck, even if you don't know it. It turns out in the 1990s, wages and incomes flatlined. And part of the reason was because a lot of the company profits that normally would have gone to salary increases or wage increases ended up being gobbled up by healthcare. So if you've got a private plan, you have something to worry about. If you are on a public program like Medicare, you have something to worry about because we're going to be running out of money. And so the status quo is unsustainable. You've got to make sure that you explain that to folks. It's not as if we just stand still, everything's going to be okay. Point number 2 is that if you don't have health insurance, we're not forcing you to go into a government plan. We, in fact, just want to set up a system similar to what members of Congress enjoy, where you have a menu of private insurance options, and we're just going to give you a little bit of help so that you can afford the premiums. That's all we're talking about. Now, one of the options will be a public option because we think that potentially could be a better deal for consumers, but nobody's going to force you into that option. It will, however, help keep the private insurers honest because if they're charging a lot more, higher profits, higher overhead, worse deal in terms of insurance, then a lot of people will say, well, I might as well take advantage of the public option. But it will be the choice of the individual. That's the second thing to emphasize. The third thing to emphasize, and probably the most important thing to emphasize when you're talking to people about this, because most people have insurance. Remember that. The people who don't have health insurance, they're already in favor of reform. But most Americans have health insurance. So the most important thing to describe to them is this will be a set of consumer protections that provide you more safety and security. You know that you will be provided for if you get sick. Because what we're going to do is we're going to say to insurance companies, you've got to do certain things, like admit people even if they've got pre-existing conditions. You can't hide under the fine print a lot of terms that allow you to drop people when they get sick or exclude them from care. In fact, the House bill actually has a provision that says insurance companies, if they want to participate in the exchange, they can only charge 15% in profits and administrative costs. The rest of the care has to go to actually making people well. So that'll be a cost control element. But the point is that all these forces taken together will help people know that when they pay their premiums and they've got health insurance, that in fact it's there when they need it.